Yes, we're working on cannabis in the last 5 years, 6 years already, on various indications. You know, I have a laboratory for cancer research. I started to check how cannabis affecting cancer, looking on Manuel Guzman and Christine Sanchez's work and following them. But quite fast, my lab grew to different indications that we saw potential. So regarding Alzheimer, there is two things that we need to look on. We can look whether cannabis can affect the adverse effect of Alzheimer, which will be a problem to sleep, sometimes anxiety, burst of violence, and things like that, which there is no doubt that cannabis can help on that. There was a very, very good clinical trial in Israel that had been done and finished and accepted for publication a few weeks ago, which showed that a high CBD strain can be very, very effective in helping to maintain the adverse effect of Alzheimer. I don't know if adverse effect is the right terminology. The side, effects of Alzheimer. Mainly improve sleeping, reducing anxiety, reducing violence, and other things. In total, improving the quality of life of the patient. And on that aspect, we are very active, doing clinical trials, doing a questionnaire with the patient, helping them choosing the right strains, understanding whether high CBD strains or high THC strains or other cannabinoid, there is strains which is 17% CBG, which look to be quite effective. This is one side of the coin. This is, I would say, the easy one, because we know that cannabis improving sleep. We know that cannabis is reducing anxiety and things like that. So if I know which strains reducing anxiety, I can fit it also to the Alzheimer patients. The big question whether cannabis can block Alzheimer disease, or if you're studying to be a dementia patient, can cannabis improve the disease or improve or block the disease progression? And on that aspect, my lab is doing in the last 4 years study. We found out there are strains of cannabis that activate the microglia in the brain. So in the brain, we have cells which are like the immune system. In our immune system, we have the macrophage. In our brains, we have their cousins called microglia. And this microglia is, in general, active in the brain like the immune system. They are cleaning, they are kind of swallowing things that are garbage that you need to throw away or things like that. And one of the things that's happened in Alzheimer, the disease is blocking the activity of the microglia. So the microglia can clean out the beta amyloid plaques, which cause one of the causes of the Alzheimer. So what we defined that there are strains that activating the microglia to be very specific, cleaning the plaques of the beta amyloids that cause the Alzheimer. So actually improving the disease progression. And in mice model, we are literally curing the mice. I will put a phrase which says that, there are things that in mice, it's very good system. If I'm taking cells from a cancer patient and inject them to the mice is just hosting them. And then I'm doing a study on this cancer, it's very similar or close to the patient. When we are studying the brain of the mice, so I would say that academically, it's a very good result. Whether I think I can cure a patient from Alzheimer, we are very far from there. But we can learn a lot about that. It makes sense that cannabis activating the microglia, that cleaning the plaques and everything, and it might happen also in humans. More of that, one of the reason Alzheimer, or one of the cause of the Alzheimer, it's reduction of the endocannabinoids in the brain. And when we follow up on patients with Alzheimer, we got from Boston 240 blood samples from a Alzheimer patient, and we check the endocannabinoids. We see a big deficiency of endocannabinoids in this patient. So now it's the egg or the chicken, what is coming first? Is because of the disease, there is reduction of endocannabinoids, or the reduction of the endocannabinoids part of the disease. And this is another study that we are doing, trying to understand that, because increasing the amount of the endocannabinoid in the body is quite easy. There are a lot of molecules, not just cannabis, that we can take from omega-3 to palmitic acid, and think that we can take as a kind of a vitamin that will increase our endocannabinoids. And if it's really important, so we can help or solve on that. So this is kind of the study that we are doing. I think, and I have the feeling that there is a big promise in cannabis in general and the endocannabinoid system understanding, solving or improving neurodegenerative diseases like Alzheimer. And in Alzheimer, for sure, in mice, I see it very, very strongly.